Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic,
which is Bordatella Pertussis. Bordatella pertussis is a globally important organism. The incidence is low in countries which do have active immunisation programs, but in countries where the incidence is higher, children are the most severely affected. Bordatella pertussis is a gram-negative coccobacillus, and it's the primary cause of whooping cough, a highly contagious respiratory disease. There are 3 toxins which are responsible for its pathogenesis, which include pertussis toxin, which interferes with host immune responses, adenylyl cyclase toxin, which inhibits phagocytic cell function, and tracheal cytotoxin, which destroys ciliated epithelial cells. So there's several stages of pertussis. Firstly, there's the catarrhal stage, which has mild respiratory symptoms, which is highly contagious. Then follows the paroxysmal stage, which is more severe, with repetitive coughing fits followed by a whooping sound, and the convalescent stage, which is gradual recovery, which still continues to have a persistent cough. There are some common complications you should be aware of from Bordatella pertussis infection, including secondary bacterial pneumonia, apnea, particularly in infants, and seizures and encephalopathy in rarer cases. The management of whooping cough is erythromycin, which is often the antibiotic of choice, but it may have little or no effect on an established infection. You can also give macrolides such as azathioprine or clarithromycin. It's important to monitor for complications such as pneumonia, and vaccinations available include the DTaP vaccine, which is diphtheria, tetanus and acellular pertussis for children, or the Tdap vaccine, which is a booster for adolescents and adults. So let's do a question. Which of the following statements about Bordatella pertussis is correct? Bordatella pertussis is a gram-positive bacterium responsible for causing whooping cough. The catarrhal stage of Bordatella pertussis infection is characterized by severe coughing fits and inspiratory whoop. C. The pertussis vaccine is a live attenuated vaccine given as part of the DTaP immunization. D. Nasopharyngeal swab culture is considered the gold standard for the diagnosis of Bordatella pertussis infection. Or E. The first-line treatment for Bordatella pertussis infection is coamoxiclav. So the correct answer here is D. Nasopharyngeal swab culture is the gold standard for diagnosing this infection.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.